Patient is a 27-year-old white female who is presenting to the clinic with abdominal pain and diarrhea. She said she has been having it for the past 2 days ever since eating barbecue chicken at a church event. She states nothing makes it better and nothing makes it worse. She describes the abdominal pain as dull and achy, and she describes the diarrhea as having at least 5 times in the past 2 days. She was at the event with her husband, who also had the chicken, but he did not become sick. She was diagnosed with diabetes 2 years ago. She was diagnosed with hypertension 2 years ago and hyperlipidemia 1 year ago. She is taking 500 milligrams of metformin for her diabetes, 20 milligrams for hydrochlorothiazide for hypertension, and 10 milligrams of Lipitor for her hyperlipidemia. She is allergic to bee stings, in which she gets anaphylaxis. She has no other drug or medication allergies. Pertinent ROS is that she has had non-bloody diarrhea for the past at least 5 times in the past 2 days, and non-bloody vomiting twice in the past 2 days. She denies shortness of breath, chest pain, heartburn, weight loss, and fever. In examination of this patient, we see the general status of this patient is alert, oriented, in no acute distress, healthy looking. Vitals 5'10", 160 pounds, heart rate 70, respiratory rate 18, blood pressure 124 over 82, temperature 98.6 degrees, and 100% oxygen saturation. On exam of the belly, we looked at it and there was no apparent visualization problems. Listening, auscultation, all 4 quadrants had bowel sounds, and on palpation, the belly was tender and soft, and pain was elicited on palpation at the upper middle quadrant. It was a negative McBurney's point, ruling out appendicitis. Differential diagnosis: salmonella food poisoning, IBS, celiac disease, anemia. Plan: rest with fluid and electrolyte replenishment, get a CBC test to rule out any anemia or any problems with IBS, and get a celiac testing done by drawing her blood. Also, we'll use the blood for the CBC.